When we think about chemo, we have a lot of kind of misconceptions, or what's the word? Hey, this is Joel. In this video, I'm going to talk about the specifics of my cancer and the actual treatment for my specific cancer. Now, all cancers are unique and quite different, so what I talk about in my treatment plan may not be the same as what's in your treatment plan. So I wanted to make that very clear. So in my previous video, you would have maybe known that my cancer is a T3M1M0. So that's a stage 3 cancer. It was actually diagnosed in the UK when I first had my tests as a stage 2, but now it's stage 3. And why fight 2 when you can fight 3? So the other thing I wanted to mention here is how big it is. It's actually 3 centimeters in size, and it's about 5.5 centimeters from my bum. So the doctor actually said, or the surgeon actually said, that in my case it's quite unique because how low it is in my rectum, which is great news. The other things I should let you know about is what the actual treatment plan is. Now, this is the standard treatment for the position and size of my cancer, and it's called a neoadjuvant treatment plan. So that means in this first phase, so what I call number 1 phase, is that I'm doing radiation and chemo, or chemoradiation. Now, what that actually means is that on the radiation side is that I go to the hospital every day, Monday to Friday, and they actually shoot radiation directly at the cancer. So I lie on a machine, it's called REEF, this one, that's a nickname for it, and for 15 minutes they zap the cancer. Now, as mentioned, I go to the hospital Monday to Friday for that. I'm also on chemo, or chemotherapy. Now, when we think about chemo, we probably have a lot of preconceptions in our mind about what chemo is, and there are many different types of chemo. I'm not a doctor, I'm not going to tell you all about them. I'll only tell you about the ones that I'm having right now. So the chemo I'm having is actually really for the radiation. So it sensitizes the radiation and makes the radiation more effective because my white cell count is lower, so the cancer can't kind of reproduce or grow whilst I'm getting radiation. Now, the chemo is actually connected to me 24/7. So you can probably see I'm wearing this bum bag, and I wear that all the time. It's connected to me all the time. And in this bum bag, I have a thing like a little sock, and then within the sock, I'll come over here and hopefully you can see it, hopefully it stays in focus. I have a thing which looks like a baby bottle. So the shape of this doesn't really matter, but what's in the baby bottle is what's important. So in here you can probably see a yellow outline, and that's actually used to be a kind of a larger balloon. Because I'm filming this on a Sunday, they give me a new one of these every Monday. But usually this is a balloon, and what it does, it slowly squeezes out the chemo. It goes at 0.5 milliliters an hour, and the chemo name is this long one there, if you can read that. So what it does, it basically squeezes out chemo slowly, and this is connected to me via cable into a thing in my chest which has been installed. The doctor doesn't like me saying installed, but really it's been installed, to a device called a portocath. That's slowly basically pumping chemo into me 24/7. So they're the kind of treatments I'm having now in what I'm considering phase 1. So as mentioned, phase 1 is the chemoradiation. I'm just going to sit back down. Phase 2 is the recovery. So after the 6 weeks of this, I have 6 to 8 weeks of recovery. Then phase 3 is surgery. And then phase 4 after that is a different type of chemo, which is a lot stronger. And that's when you have more of the side effects of losing your hair, and kind of maybe the preconceptions that we have about chemo is what I'll get after surgery. And this is the standard plan for, as mentioned, for this type of cancers. Maybe different to what the treatment plan is for you. As my wife likes to say, we're patients, not protocols. So everyone's unique in this scenario. So in a future video, I'm going to show you what my portocath is and kind of freak you out a little, hopefully, in a good way, what it looks like to become like half a cyborg. So see you soon. Thank you.